Evangelical Community Hospital's Talk with the Doc series, weight loss procedures.
All of bariatric surgery, and there are, like I said, a number of different operations, work on two basic principles. One is restriction. We restrict how much you can eat, and the other is malabsorption. The gastric bypass, for instance, uses both restriction and malabsorption to promote weight loss, whereas the laparoscopic adjustable band is primarily a restriction type of operation. The criteria for surgery: body mass index of 35 and above with medical problems. It takes a lot on your part. It takes a highly motivated patient. It takes a knowledgeable patient. When I say knowledgeable, I mean well-informed patient. Motivation for behavioral changes, lifestyle modifications, willingness to participate in a regular fitness routine, and willingness to comply with the post-operative dietary modifications, which can be fairly severe at first. So when you start the program, usually you come in, you have an initial consultation with myself. We sit down, we go over pretty much everything. The other big part of the program that we stress a lot, and my favorite thing, is exercise. Anything that you find enjoyable is going to be, you're much more likely to stick with it and stay with it throughout your life. We also look at, from a metabolic standpoint, your hormone levels, your thyroid function, your adrenals, which are organs on top of your kidneys that secrete hormones. We look at your blood sugar levels. We try to find, is there anything else out there going on with your medical history that can be causing weight gain. After the preoperative phase, and we do require patients to lose about 10% of their weight prior to it. We also require patients to stop smoking if they are a smoker. Patients undergo a psychosocial testing with a psychiatrist or a psychologist. After you go through it, you realize it's not that bad. After you do that, you've lost your weight, you've passed the psych test, you feel knowledgeable about the surgery, you know what type of diet you're going to have to eat afterwards, you're socially and medically prepared. It's time for surgery. We do the surgery, you go home from the hospital, and now the important, really important part is strict follow-up, compliance with the diet, informing us of any problems. I see my patients back the very next week after surgery. I then see them about 2 to 3 weeks after that, a month after that, monthly for several months, and then once you get out to about 6 months, I start seeing you about 3-month increments. So about a year, then I'll sometimes, if you're doing great, 6 months, and then yearly thereafter. Food is not the enemy. A lot of people kind of get that attitude that food is it's a guilty pleasure. It makes us feel good, and bariatric surgery doesn't have to erase that.
To explore your weight loss procedure options, please call 570-523-3290